Hey y'all, it's your girl Shady Lane 2121 coming at you with a video that was requested by actually a lot of people. I was surprised. And it is about nursing. I just got home from work and I'm a nurse. So let's get to it. I get asked a lot what kind of nurse I am. I am an RN, a registered nurse. I am an ER nurse. I work in the ER. Hence, ER nurse. So let's just go through a couple of things. I get a lot of questions about how should you wear your hair if you're a nurse, how should you do your makeup when you're a nurse, things of that nature. And I'm going to try to touch on that, but I'm a different type of person, so I kind of just go with the flow. My daughter is potty training. Hold on a second. So, as I was saying, I pretty much go with the flow. Where I work at, they know how I am, and they've pretty much gotten used to it. Sometimes I call myself the Mimi of the ER because, you know, I will come in with some crazy eyeshadows or crazy hair. They know that I wear wigs because I change them quite frequently when I wear them. Every couple of days I would come in with curly hair, then I come in with straight hair, short hair, you know, whatever. But where I work is okay with it. So you have to fill out your environment. Like if I were to work somewhere that's like in an office or a school nurse, or like they have occupational nurses that work at like businesses, then I would tone it down some. I'd probably wear neutrals. How I have my hair now is fine, in a ponytail, buns. You can have your hair down, that's fine. It just really depends on where you work. That's the main thing. You have to fill out where you work, see how the people around you are and what they're wearing, how their makeup is. Now where I work, I'm the only one that's pretty much like I am. So, I mean, I'm always done up. Everybody's like, oh, you're such a Barbie. You always come to work all done up. I don't know how you do it. You're always with your makeup on. And that's just, you know what I'm saying? That's just me. So it really depends. So I've been asked as far as like day in the life or whatever, a day of being a nurse in the ER. Well, it varies day to day because I can be in the critical area, I can be in triage, I can be answering the telemetry calls of the ambulances coming in, I can be in a regular zone, I can be in fast track, I can be in the annex where there's psychiatric patients. So it just really depends on where they put me that day. But usually what I like to try to do is if I have time, and I say if I have time because a lot of times I'll come into an area and I'll have patients already in my rooms waiting. Today I didn't, which was actually nice, and I was able to go through, get all of my materials that I needed ready. And what I mean by that is we start IVs and draw blood. So what I do is I go and I get little baggies and I set up everything that I need to draw. I get my labs, my tubes for my labs, I get my needles for my IVs, I get my start kits, I get my flushes, I get my bags of saline hung for boluses and fluids that need to be run. So I get all that stuff prepped so that when my patients come in it's already done and I just grab a bag, grab a fluid and roll in. It's a little different in the ER because we have more autonomy in the ER. A lot of times a patient will come in and be brought to our room and they'll tell us, you know, they've been triaged, it's an abdominal pain, they've had nausea, vomiting, diarrhea for 3 days, can't keep anything down. Before the doctor even gets in the room, I already know they're going to need an IV, they're going to need labs, they're going to need fluids, they're going to need to be hooked up to the blood pressure and the O2. So I already know these things. So right when they bring them back, I'm in the room, I'm starting their line, I'm drawing their labs, getting urine, and getting them hooked up to their fluid. So when the doctor comes in, he assesses them, he writes the orders, they're already done with the exception of any medication for pain and for nausea that I have to give. That's me. That's what I do. I like to get it done. Some nurses wait. I don't. There's no need. I've been there for 5 years. I know the doctors. I know the routine. Again, it depends on where you work at, how that works for you guys. I have 4 patients if I'm in a regular zone. If I am in a critical zone, I have 3 patients. We have a tech usually. If we do not have a tech, then we have 3 patients. In the ER, we do, like I said, we do our IVs, we do our blood, we do catheters, we do bladder irrigations, we intubate patients, CPR, cardiac arrest, codes, insulin drips, enemas, we do conscious sedations if you have dislocations, we do septic protocols, we do everything. We're the ER. So anything that comes in, we get it first. We stabilize it and we send it to ICU, we send it to a telemetry floor, a med surg floor, whatnot. So basically, I deal with my 4 patients, getting them over to their tests, CAT scans, x-rays, whatnot. Being an ER nurse, the biggest thing you have to worry about is prioritization. You need to know how to prioritize. Being any type of nurse, you need to know how to prioritize. Because you need to know when you come in, like me sometimes, I'll get slammed and have 4 patients at one time. Well, I'm only one nurse, I'm only one person. So you have to learn to say, okay, I have this guy over here who has chest pain, who has history of having heart attacks, and he's pale, he's clammy, and he looks like crap. And then I have this other patient over here who has nausea and vomiting that's had it for a week. And I have this other one over here that's having some vaginal discharge and some itching. And then I have this one over here that has a foot ulcer that they've had for months and months and months and months. So you look at your 4 people and you say, well, you know what? The JJ's going to have to wait, this foot's going to have to wait, and this nausea vomiting is going to have to wait. And guess what? The heart guy, he's going to be the one that you see first. So it's just things like that that you have to learn how to deal with. Sometimes you'll have freaking 3 sick patients. You'll have the guy that's clammy and freaking having a heart attack, and then you'll have this person over here that's having a brain attack, a stroke. So it gets hairy in the ER sometimes, and you have to learn to ask for help, and sometimes you don't have that help, and you just have to make some hairy decisions and try to balance. There's different types of nursing. There's from aesthetics, working in like a doctor's office, doing surgeries, doing dialysis, telemetry. There's home nursing. There's forensic nursing, sexual assault nursing. There are so many different types of nursing jobs out there. Where I'm from, there doesn't seem to be as many nursing jobs right now because of the economy as it used to be. It used to be you can open up a newspaper and there was just pages of jobs, and lately there just has not been that many. There still are jobs out there. So I have people ask, would you suggest becoming a nurse? Any tips? Nursing is a great career. You will always have a job. It does pay well. It is a lot customer service oriented, I will say. And by that I mean the customer is always right. And you have to learn to kind of be two-faced. Really, you really do. Because you'll go in and you'll see someone that's there all the time, a frequent flyer. They are there like 5 times a month, and oh my God, oh, I really need my dilaudid. I need my dilaudid, my back, my back, my back. You know? And so you'll get the chart, and you're like, this motherfucker, I can't stand this. He gets on my damn nerves. This bastard is always here. And you're walking, I cannot believe he is here. Why do we keep giving him shit? Walking, and then as soon as you hit that door, it's, hi, Mr. Johnson, how you doing? My name's Amber. I'm going to be your nurse today. How are you doing today? Not so good? I'm so sorry for that. We're going to do our best to make sure that we get you feeling better today, okay? What's bothering you today? Your back? Okay, we're going to make sure we take care of that for you. That's what I'm talking about, okay? You can sit there and cuss him out under your breath all you want outside the room. I hate him. I can't stand his ass. But once you hit that door, you have to be able to turn on that smile and be able to go in there and act like you actually like this person. Because That's just what you have to do. As a nurse, we can't judge people. Well, that's a lie, that's a lie, that's a lie. We do, but you can't treat them in the way that you're judging them, if you feel what I'm saying. You will, well, I don't know, in the ER, where I work, you will deal with people that are there on a regular basis. You will know them by name. You will know them by face. You will know their allergies. You will know their history because they are there so damn much, okay? You will need to learn to deal with doctors that are going to give them the narcotics that they want anyways, even though you know they're there being a seeker. This is shit you have to deal with. If you're going to be a nurse, if you're going to be in that environment, these are things you have to deal with. You cannot be squeamish if you want to be a nurse. You will see blood. You will see, again, well, let me say, in the ER. You will see blood. You will see bones. You will see gunshots, stab wounds, stuff stuck up places they don't belong, stuff stuffed inside of wounds. You will see people bleeding out. You will see people vomiting blood. You will see people crapping blood. You will see people with tubes here, tubes there, colostomies. You will see a lot of body parts that you probably don't want to see on older people, or stick things in those orifices, but you will. You will see dirty people. You will see people with lice. You will see people with scabies. You will deal with rude people. You will deal with crazy people. Crazy people. Yes. You will deal with some crazy people. You will deal with people and you're just like, damn, this dude is crazy. Yeah, you will deal with those. What else will you deal with? You will deal with people vomiting. You will deal with people having diarrhea. You will deal with people... Here's my biggest thing. You will deal with people coming in with 15 family members, and all of a sudden, no one can help their family member. No one can help them sit up. No one can help them stand up. All of a sudden, people get to the hospital and they don't know how to use the toilet any longer, even though they've been using it before they got to the ER. I've had people just shit in their bed because they don't want to get up and use it all of a sudden, and then tell you to wipe them, and they're my age, 30. Yeah. No, that doesn't happen very often because I tell them, here's some wipes, you clean it up. What else will you deal with? You will deal with racist people if you're African American, such as myself. I've been called a colored girl, or I've been called nigger. Not very often. I can count on my hand how many times. You will have to deal with racist people, and you will still have to put on a smile. How you doing? Now, if someone were to call you out of your name, then you would say, you know what? I'm going to have another nurse take care of you because I don't think we're going to jive too well. But I have taken care of people with swastikas all over their body, and we've been fine. What else can I tell you guys about nursing? You do have those days where you have actually nice patients that you appreciate, and they make your day nice, and you realize why you became a nurse in the first place, because you wanted to help people. Like, I had a nice young lady today, and she was so pleasant, and it was a joy to take care of her because she was just so pleasant. She was kind. She didn't care about the wait. She had to wait to get a room. She was just a beautiful person, and I really appreciated taking care of her. You have those people that say thank you, and that will make your day because you don't get very many thank yous being a nurse. Sometimes being a nurse is a thankless job because everybody always wants to thank the doctor. Oh, thank you, doctor. You took care of me, cured me. Hallelujah. But no one ever says to the nurse, thank you for drawing my blood and starting my line and wiping my ass and giving me the meds and making sure my vitals were okay and going and tell the doctor, hey, she needs more pain medication, or hey, can she eat, or hey, you might want to x-ray this, or hey, doc, did you hear her lung sounds, or hey, doc, I think she might need some therapy, or hey, no. You don't get that. It's a thankless job sometimes. What else can I tell you guys about nursing? Always be prepared. Be prepared for any and everything. Because you can have a patient come in that looks just as healthy as I do right now, and you could turn around and that patient totally bottom out on you within a matter of minutes, and it's happened to me quite a few times. So always be prepared for the inevitable. Also, just a quick tip. Never, ever, ever, ever take out an IV until you are discharging the patient, about to boot them out the door. Because I have had patients crash on me and they're like, oh, the doctor's like, oh yeah, go ahead, take their line out, they can get ready. 20 minutes later, still waiting for the discharge, and what happens? Blood pressure drops, or they start vomiting, something crazy, and you gotta stick them again. That's just a random tip from me to you, but whatever. Know that you're not always going to like everybody that you work with. Know that there are going to be people that don't always pull their weight. Never expect your tech to do anything that you wouldn't do yourself. If you're not busy, try to help your tech. Do not, if you can help it, ask for menial tasks to be done that you can do yourself while you're in the room. I hate when I see people say, hey, can you go grab me a temperature, and you're sitting there not doing anything and that tech is busy. I try my best to like get vitals and help do EKG. Like, I'm not going to sit there and chase down a tech to do my EKG while my patient's having chest pain and sit there and run around the ER looking for them when I can just do an EKG myself. And I've had the experience of seeing a nurse the other day trying to do an EKG herself, and she didn't even know how to do it. Yeah, because she always has her techs do it. So make sure that you know how to do anything that your techs can do, because you may need to do it yourself. I don't know what else. I think that's about it. I don't know how long I've been rambling. But if you have any other questions, feel free to ask me, and I'll do another video if there's more stuff you guys want to know. But this is just a quick on-the-fly gist of nursing to me. I don't know if I addressed any of what you guys wanted to know, but that's just what I felt was pertinent right now. So, anywho, if you guys found this helpful, go ahead and rate and comment and subscribe. And if you're not following me on Twitter and Facebook, please do so now. I will put the links above, here and here and here, if they're not already there, whatever. So, yeah, talk to you guys later. Smooches.